Well, a very good morning to you once again, live from the ANC's National Policy Conference, Day 4. As we've been saying since this morning, one of the major issues that we're also expecting to take centre stage here is health issues in South Africa. But before all of that takes place, we understand that President Jacob Zuma will do a walkabout at the Expo Centre here, just as you saw yesterday, the Deputy President doing an expo, or rather doing a walkabout at the Expo Centre, and after that speaking to the media. We look forward to, I guess, some kind of engagement. Yesterday, we were not allowed to ask questions to the Deputy President. We'll see if we'll try our luck with President Jacob Zuma after he does that walkabout. Let's chat now to ANC NEC member and the Minister of Health, Motsoaledi, this morning about the health sector and perhaps what's expected to come out of this policy conference. Thank you very much for your time, and Motsoaledi. The health sector, is one of the critical cornerstones of South Africa to ensure that we have an efficient healthcare system in South Africa. But what kind of policies would we expect to come out of this policy conference that would improve the status of healthcare in this country?
Morning, Griselda, and morning to the viewers out there. Without any hesitation, I can tell you there are two commissions here which are going to discuss education, health, and science and technology. In both of them, I'm going to make a presentation on what we released last week, the policy document on national health insurance, because that's going to be the main thing. Let's forget about all the other things, because the main thing for this conference is to come up understanding the national health insurance. As I said in the press conference last week, is going to be our center of gravity, because that's the only way that will be able to reform the healthcare system. And remember, that concept, which is called universal health coverage internationally, is not only a South African concept, it's a world view of health, that in order for health to develop and every citizen on this planet to get access to good quality healthcare, countries needs to implement universal health coverage, which in our case we call NHI. So by far, that's going to be the main policy that comes out of this conference.
Many South Africans would perhaps say, the health sector can do much more to improve, in particular when you look at state facilities. How will this health insurance take healthcare in this country from the point where it is to ensure that, South Africans change their minds, some of them who might be of the notion that, if you go to a state hospital, for example, you don't specifically get the kind of care that you would get at a private facility?
Indeed, all those are outlined in the policy document. If you read paragraph 2 of the policy document, it has got more than 300 paragraphs. Just if you go to paragraph 2, because paragraph 1 is a definition that says NHI is a health financing system which is designed to pool funds to give access to good quality healthcare to all South Africans in terms of their health needs, irrespective of their socio-economic status. That's the definition. The second paragraph clearly states that this is a major policy shift. It will necessitate a massive reorganization of the healthcare system, both public and private. So they are going to be reorganized, and it goes on to mention steps on those how we are going to reorganize the healthcare system in terms of human resources, in terms of financing, in terms of infrastructure, in terms of bringing primary healthcare at the center of the whole healthcare system.
That is one of the issues that I wanted to bring up. A shortage of medical staff. When you look at maladministration as well and lack of resources, does that seek to address as well those kinds of issues?
Absolutely. Because people tend to forget where these issues emerge. We are running a healthcare system here, Griselda, which is already spending 8.5% of the GDP on health. That's too much. It's a lot, because the World Organization recommends that countries must spend at least 5% of their GDP on health, and they'll have to have good health outcomes, and all those problems we are saying will disappear. Now, if you don't understand what 8.5% means, an average European country is at 9%. Our BRICS partners like Russia, they are still at 5.4, China at 4.6, India at 4.2, but they've got better health outcomes. Why? Because out of that 8.5%, 4.4 serves only 16% of the population. And the remaining 4.1 serves a staggering 84% of the population. Now, no country in the world can be described in those terms. In other words, we are the only country in the world, and this has been confirmed by the World Organization, which is spending so much money on so few people. In simple language, out of every 100 people, our healthcare financing system only caters for 16 people. Out of 100, that's what NHI wants to change. You can't run a health system like that.
All right, I'm afraid that's all we have time for there. ANC NEC member and the Minister of Health, Motsoaledi, talking about some of their ambitions coming out of this national policy conference when you talk about improving the public healthcare sector in South Africa. Well, we've been with you on Morning Live for the past 3 hours. Thank you very much for joining us. We will continue with our coverage here on Channel 404, and we'll bring you regular updates from here. President Jacob Zuma, as I indicated, will do a walkabout at the exhibition centre here, and we're hoping to have a chat with him once he does that about the developments here at the National Policy Conference. Thank you very much for joining us. Have a wonderful day.